Hi, welcome to Body Beautiful. I'm Janelle Marie. I'm here today with board-certified plastic surgeon Dr. Joseph Mealy in Walnut Creek, and we are talking about otoplasty, doctor.
Yes, we are.
Thank you so much for joining me. Otoplasty, a lot of people don't know what is
Otoplasty is a medical term for ear changing.
Oh,
so
that's
we're
easy.
not swapping them, we're just changing the shape. But often if people have prominent ears that stick out,
Yeah.
they want to bring them back in. That's what otoplasty can accomplish. We call it ear pinning. And there's also people born with sometimes funny shaped
Right.
ears with little, like a Spock ear or a cupped ear. That also can be corrected. And things like cauliflower ear, which
Oh,
we'll see on
yeah.
wrestlers, boxers.
Right.
These are all different types of otoplasty.
That brings me to a question. You know, since some people are born with it, how young can you do otoplasty on a patient?
Oh, well, for things like prominent ears, the ear is about 85% of its adult height by age 5.
Oh, really?
So prominent
Okay.
ears, we can do ear pinning at age 5.
That's,
If you have a newborn, you can start trying to shape them sometimes with just a helmet. If they can start
Okay.
that in the first week or two of life, sometimes you can avoid having surgery.
yeah, 'cause, it is a big deal for sure. Let's go to picture number 1 because this is amazing. What's going on here?
So this is a young woman concerned with her ears, uncomfortable wearing her hair up, doesn't
Mm-hmm.
really want to show her ears off, though they're beautiful, they're perfect. They're just prominent, they're rotated forward. And in her case, the concha, the part that catches the sound, is very large,
Yes.
and that's rotated forward, which brings the whole ear forward.
Wow.
So what I've done is otoplasty, basically make an incision in the back of the ear. I can remove some of that cartilage or thin it as needed and bring the ear back. In addition, sometimes that fold that runs around the inside of the ear that helps fold the top in isn't there. We can recreate that too. But the nice part is the scar's
Yeah.
in the back behind the ear.
Can't see the scar at all. And what would be the downtime on this surgery?
So with the otoplasty, I do wrap up the head for a week.
Oh, you
so
do?
You're stuck with
Okay.
a turban for that first week. And then after that, I have you use a sweatband, but just at night to keep the ear from folding forward. And we do that about 3 months. Normally,
Wow.
by a week or two, the ear looks pretty normal, so you can go out and about.
And this reminds me of a comment because you can leave comments for the doctor underneath if you want to ask the doctor a question. And future segments, we can answer those questions. But there was a comment from a young lady named Jenna. And she said she plays baseball, you know, for her school, but she's very shy about wanting to wear the baseball cap with the
Sure.
ponytail through it because she loves doing that, but can't do that because her ears
Yeah.
are prominent. Can you help
Well,
Jenna
very
out?
common, especially with athletes.
Yes.
If you're playing sports, you don't really want your hair
Yes.
flying around. Wearing that ponytail kind of takes your ears out. So often we'll repair that by pinning the ears back, bringing it back in so people feel comfortable.
All right, so we can definitely help Jen out. Remember, leave comments below and the doctor can answer them. All right,
Sure.
picture number 2, we have a man.
Sure, so this is a gentleman, same problem. Men, we tend to wear hair shorter.
Yep.
So we tend to be a little more concerned with it.
Yep.
In most plastic surgery, the majority of patients are women. With otoplasty, I'm thinking it's about 50-50.
Wow.
Yeah, so pretty common for men.
And
But the nice thing is, again, the scar's hidden
Right.
behind the ear, so even with short hair,
Exactly.
don't usually have to deal with it.
now, what do you do? Otoplasty under general anesthesia?
I can do it under general or I can do it under local.
Oh,
I
okay.
think for
Yeah.
children, general works a lot better because it's hard to have delayed
That's true.
gratification with children. For adults, if they're very nervous, worried about it, one of the things is you can kind of hear me working. If that's going to bother you, then general works great. And if you're motivated and okay with local, that works well too. The advantage being less grogginess.
All right, so men and women about 50% on the otoplasty.
Yeah.
All right, let's go to the next picture. You know, a lot of women love to wear their hair up if they're going to
Sure.
a fancy dinner or just wearing their hair up in the summer, whatever the case. So it looks like this might be the case here in the next picture.
Yeah, she just like to wear the hair up, and she wants the ears brought in. And in her case, they're in, and they kind of point down a little bit because that upper anahelical fold isn't quite fully developed. So
Right.
similar to the others, we're bringing the ears back, removing cartilage as necessary, or reshaping it as needed, and hiding that scar in the back. Now she can wear her hair up and not have to worry.
And when you say that the covering that you have them wear for a week after, does that go around the ears, the chin?
Yeah, it wraps up the whole head.
Yeah. And so you have to sleep with
Because
it,
the goal
obviously,
is when you're
correct?
sleeping, we don't want to fold the ear the wrong way or have
Yeah.
trouble, and this just makes it a little more bulletproof.
So it'll stay on for sure for a week after.
Yes, it should.
Okay.
Yeah, if it comes off early, chances are greater
Yeah.
of recurrence.
All right, and our final picture here, this is drastic.
So this is another woman with really asymmetrical ears.
Very much so.
So they're both prominent, but the left one is really missing that anahelical fold that brings the top
Yeah.
in. And she has a little bit of a bump there. We call it the Darwin's tubercle. Hers is kind of flatter. Sometimes they're very pronounced. So what we've done is just, again, bring it all back, get it out of the way. And it's important to note that if you have prominent ears and they don't bother you, they don't need to be fixed.
Exactly.
This is elective. It's because it's bothering the person who has the ears.
Yeah, and you know, a lot of young kids can get bullied for something like this, I would assume.
Yes. Yes,
For
and for some, it's nice to be able to get rid of that ridicule.
Exactly. And do you ever have to do it again, or are we done with one otoplasty, never again?
Usually once is enough. If they do recur, they tend to recur early, so usually within 3 months.
Oh, really?
But not as prominent as originally.
Yeah.
Usually it'll come out a little bit, or there'll be a little asymmetry. Then we may have to do a little touch-up, and that often we can do in the office under local.
That would be simple.
Yes.
So if it ever happened, okay, good to know. All right, you can see all these before and after pictures on the website, sanfranciscobreast.com or drmealy.com. You can also call the office. It's 925-943-6353. It's been fun talking to you about
Nice talking to
otoplasty,
you.
Doctor.
Always a pleasure.
Always a pleasure. We'll see you next time on Body Beautiful.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor. The opinions expressed on the program are those of the guests and not those of Cron TV, its management, employees, or advisors.